Hello everyone. Welcome to Yashoda Hospitals online segment, the Health Talk session. Let's discuss about overall well-being of women in today's episode. I'm Dr. Lakshmi and let's welcome Senior Consultant Obstetrician and Laparoscopic Surgeon from Yashoda Hospitals, Somaji Guda. Welcome, ma'am.
Hello, Lakshmi.
So, ma'am, tell us more about yourself and your journey in this medical field.
Yeah, that's an interesting question. I'm Dr. Shantha Kumari. I'm a gynecologist and I happen to be the president of FOXI, the Federation of Obstetrics and Gynecological Societies of India, which has 38,000 strong body of OB-GYNs. And I am the treasurer of FIGO, the International Organization of Obstetrics and Gynecology, headquartered at London, and global presence is more than 132 countries.
So, ma'am, what made you choose this field? Was this by choice or by chance?
I happen to be a child of two doctors, and yes, I have become a gynecologist by chance and not by choice. In those days, I wanted to go into hospitality business, but in those times, it was unheard for that a child of doctors would go into hospitality. So I did study very hard to get into medicine, never realizing that I have to work harder the rest of my life in this career. And later, during the post-graduation, I wanted to do some other specialty. I never wanted to do OB-GYN, but destiny had other thoughts. So I have become a gynecologist by chance because that was the only available seat when I went for my counseling.
So, ma'am, you just said that becoming a doctor was by chance and not by choice. So what were the challenges you faced in your initial career days?
Well, I was very lucky because being the daughter of two doctors, well educated and with very forward thinking, I didn't have much challenges in my growing up phase, which I was very, very lucky. So I had all the facilities, and of course I did work very hard to become a doctor, and later on after doing my post graduation follow my passion to be into the organization and take care of women's health. And I think the support which I got from the family was absolutely fantastic, which actually resulted in helping me be whatever I am today.
That's rightly said, ma'am, that family support is the most important thing to achieve success in any career. So, ma'am, we know that you're an inspiration to many doctors out there. So, on a personal note, who was your inspiration to choose this career?
Yes, that's a very emotional question. My inspiration in the beginning was my grandmother. She was called Manager Amma, who had become a widow at a very early age with 10 children to fend. And mind you, she did the best possible, and they all grew up to be fantastic in so many different professions. And she was an inspiration for me to show that a woman can achieve anything in whatever the circumstances they are, because they're very strong emotionally, and that is the spirit of what every woman should have. And of course, later on in my career, there have been a lot of inspirations, especially in the field of gynecology and obstetrics. And before I went into that, my father, Dr. Shekharan, who is an ENT surgeon, my mother, Dr. Satyavati, who is a gynecologist, have been the source of my inspiration too. And in gynecology, it was Professor C.N. Purandare, who was not only the president of FOXI and the Federation of OB-GYN FIGO, and Professor Sir Sabaratnam Arulkumaran, and many more seniors who have been the inspiration in my journey in FOXI and FIGO.
That's a lovely, inspiring story and a wonderful journey, ma'am. So, what else would you like to do to de-stress yourself?
Being an consultant, I used to be very busy a few years back with a lot of practice, and then having to deal with growing up in the organization. It used to be very hectic, yes. So many times I used to drive right back from the airport to the hospital, go to the theatre, do some emergency surgeries also. So it used to be the very hectic lifestyle, but then being in the organization, being in FOXI, doing the academic programs used to give me a lot of strength and probably that relaxation which was needed to keep me going. I think when you like something, you do anything with passion, that will keep you going. If you don't like what you're doing, you will never be able to achieve or be the best in that whichever aspect of life you chose to be. So enjoy what you're doing, follow your passion, and the best in you will come up.
That's a nice way to de-stress, ma'am. So apart from this, are there any social issues which are affecting a woman's health?
Yes. I have actually initiated an initiative called Dhira to stop violence against women. We have seen the past few years back when I became a member of No to Violence Against Women of the working group of FIGO in 2015. We realized that violence against women has a great impact on the health of women. It affects the women's health, it affects the maternal morbidity and mortality, and affects the overall health of the women. And what we have seen in this pandemic is the violence against women has become a silent pandemic affecting the health of women. And it's the responsibility of each one of us to help our women to actually overcome this problem, because they may come to you with some pain abdomen, they may come to you with some menorrhagia, they may come with sometimes very simple problems, or they may not have any problem. They keep coming repeatedly to you in your OPD. Just take 1 minute and see what is behind those symptoms. You may find sometimes a domestic violence, you may find an intimate partner violence that could bring out this problem. So to sensitize the OB-GYNs and the physicians and the public, and of course to partner with men and women to say no to violence against women is so very important when we want to take care of women's health overall. And I am sure that when we address this issue, the impact it will have on the health of the woman and the family will be so good. We will be able to reach the SDG goals, and we will be able to take the country to greater heights health-wise and even economy-wise.
I think that's a wonderful and a very important initiative, ma'am, especially as overall well-being of a woman is concerned. So talking about women's health, what advice you would like to give to the women out there?
Women are so very important. Friends, let me tell you, I have traveled globally being in various organizations, but I have always found that women in India, we are more empowered than women in many other parts of the world, be it even America or the Europe. We actually have our own strengths. We are the pivotal bodies of the family. You are so very important that you are taking care of your family, your children, and everyone around you. What I would request is you have to take time to take care of yourselves. Take care of your body, take care of your physical and mental health. Make sure that you are not anemic. Make sure that you have your screenings done. Make sure you have your pap smear done, your HPV test done. Make sure you have your mammogram done. And when you have this sort of an approach and you are sure that you are taking care of your health, obviously that will lead to better health, and when you are healthy, you can take care of your family, your society, and everything in a much better way. That's so very important. And friends, what I have found is doctors who are so busy taking care of the health of everyone actually are very bad examples when it comes to take care of themselves. So I will urge all the doctors, please do take care of yourselves. Take care of your health, do your health checkups, and be very healthy, because that is the way forward. And take care of your mental health. See that you don't get stressed out. Be happy, and you will be able to get an happier outcome out of your patients also.
I second that. The doctors are poor health takers when it comes to themselves. So talking about overall well-being of women and mental health, how do you balance your work life?
In fact, the COVID pandemic has shown that we have been so busy. I used to travel 3 to 4 days in a week sometimes. It used to be airport to home to hospital to airport. There was never any time actually to spend for personal time, but I made sure that over the past 20 years that my morning walk was very important, which I used to go. Of course, it never used to be very early in the morning, but nevertheless made sure that I go for my walks regularly. But still sometimes now we find there's so many I think small things which we need to take care of. And most important is whenever you feel that you are overworked or stressed, you need to have a let out. Those may be just having a friendly chat with your friends. You have your own group of close friends with whom you can share. They may be your own colleagues, they may be doctors, they may be non-doctors, somebody whom you can just share your happiness and your stresses. That will definitely lighten those problems, and that will help. Of course, it has helped me, and I'm sure it will help everyone when they do that.
So before ending this episode, what message you would like to give to the upcoming doctors out there?
We keep hearing that nowadays medical profession has become so stressful. There is so much of medical legal issues and so much of stress, mental stress and all. But let me tell you, we need good doctors. So if the brilliant children don't take medicine as a career, imagine what sort of life we will be having, because we need the generation next doctors who are good to take care of our health. So I will definitely urge all the intelligent boys and girls, if you want to do medicine, please don't get worried and don't get disillusioned by listening to some sob stories told by many of us. World is not so very bad, medical field is also not so very bad. So if you are really inclined to be a doctor, I would definitely urge you all to take medicine as your field, because we need passionate doctors, the next generation doctors, to take care of our health and the health of the people of our country. So please do become doctors, good doctors. Everyone needs good doctors.
Thank you, ma'am, for the wonderful message, and it was lovely talking to you.
Thank you. It was a pleasure being with you.
So this brings us to the end of this episode. Hope you all enjoyed watching us, and do join us for the next week as well. Thank you and stay safe.